Ventricular tachycardia is an abnormal heart rhythm coming from the bottom chamber of the heart, and it can be fast, and it can make people feel dizzy, lightheaded, and people can pass out from it. And for extreme cases, people can die suddenly because of ventricular tachycardia. So ventricular tachycardia is different from a heart attack. A heart attack usually means there's an acute occlusion of the coronary arteries. It's more like a plumbing issue, as opposed to ventricular tachycardia. It's an abnormal or lethal heart rhythm, and it's more like an electrician's problem. Yeah, so the symptoms of ventricular tachycardia include, irregular heartbeat, fast heartbeat, and or strong heartbeat. Sometimes people can feel very short of breath because of it, and for other cases, people can feel dizzy, lightheaded, can pass out, and for unfortunate individuals, they can die suddenly. The most common reason for ventricular tachycardia is in this country is coronary artery disease, which means there's acute occlusion of the arteries outside the heart. It can lead to scar inside the heart, and with that, it can be circuit, and that can sustain abnormal rhythm. Aside from that, there are other reasons that can lead to ventricular tachycardia, such as genetic cardiomyopathy, which is a heart muscle disease. The first was, in order to treat ventricular tachycardia, there are a few things we need to consider. Number one is to understand the diagnosis of it and understand what is the underlying heart disease. With different heart disease, whether it's coronary artery disease, hypertrophic cardiomyopathy, or some other heart muscle disease, the treatment can vary. And then we have medications that can slow down the heart rate and also suppress the ventricular tachycardia. They can be helpful for many individuals. And in addition, a defibrillator is usually recommended for people with abnormal heart function and the ventricular tachycardia to prevent the recurrence of it and to prevent sudden death. And in addition to the above treatment, there are therapies such as ablation, and that should also be considered if there is recurrent ventricular tachycardia. So the SBRT is a type of ablation. There are two. Well, traditionally the ablation is done through catheters. It's called catheter ablation. It's an invasive procedure. People are lying on the operating table. We go from the groin with catheters going inside the heart, and then we'll touch different area of the heart with a mapping catheter, try to understand where the substrate or the scar is, and then by reproducing the tachycardia, we can understand where we should ablate or burn. Ablation means burning to cause tissue death and destroy that circuit responsible for this bad rhythm. And the issue with catheter ablation for ventricular tachycardia is that it is invasive, and it's usually a prolonged procedure, and people will need to be staying in hospital for a relatively long period of time. And so because of that, many people or many patients are hesitant in getting ventricular tachycardia ablation. The alternative that we can offer here is something called a stereotactic body radiation ablation. It's also called radio ablation for the heart. And very few centers in this country offer this therapy. And the idea is that I, as an electrophysiologist, will figure out where this bad rhythm is from, and we work very closely with our radiation oncologist, and then they will deliver the radiation therapy to the areas of interest. And it can be done as an outpatient setting, and people feel like it's getting a CT scan, and then it has been shown to reduce the ventricular tachycardia recurrence and then improve quality of life. Ventricular tachycardia is a dangerous and complex medical condition. For patients who have it, it's very important to go to a highly specialized center. And here at Marshfield Clinic, we have all the tools that we need to treat ventricular tachycardia. We have the right medications, and then we have all sorts of ablation therapies. And for the right patients, the radiation therapy will certainly be very helpful. And if you need to chat with us, we'll be happy to schedule a consultation with you.